assistant professor here at the University of British Columbia, and my main area of research is looking at osteoarthritis, people who have that disease, and looking at ways to better treat and to better manage their symptoms through exercise and other types of modalities like that. So arthritis is kind of a family of disorders of the joint. And in essence what it is there's cartilage, which is a smooth lining at the end of bones. And arthritis is the breakdown of that cartilage. So over time the cartilage gets worn down, people have developed pain and dysfunction, the joints get stiff, and they're unable to move as freely and as smoothly as they did before. There's many different types of arthritis. The most common type is osteoarthritis, and osteoarthritis is typically known as a wear and tear disease, and you might have heard that said before. And in essence what that means is that the joints get overloaded and the joints get worn out over time, and the articular cartilage, which is typically able to respond to those loads and forces that go through the joint, is no longer able to keep up with that. And what happens is over time, the more the person is putting loads through those joints, the greater that breakdown of that cartilage. This is in contrast to other types of arthritis such as rheumatoid arthritis or gout, which are more inflammatory types of arthritis where the body kind of attacks itself. And the causes of rheumatoid arthritis and those types of arthritis are not really as well known. You may have heard of the term autoimmune disease, and those types of arthritis are more autoimmune, whereas osteoarthritis is more of a mechanical disease. It's that overloading of the joint. There's lots of causes of arthritis. There's no real number one known factor that you can say if you take this away, then you can prevent osteoarthritis. There's a number of different factors. Age is really the main risk factor. We know that osteoarthritis affects people who are older more than it affects people who are younger. There's other factors such as weight, so people who are obese tend to be at a higher risk for developing osteoarthritis, and that kind of goes back to that whole notion of the wear and tear disease. They're putting more loads, they're putting more forces through their joint, and over time, that cartilage that's at the end of those bones tends to break down. There's some suggestions that genetics play a role, not so much that you would inherit the disease itself, but things like body size and body shape, your obesity types of things, those are typically more hereditary, and so people who would have more overweight parents tend to be overweight themselves, and that puts them at an additional risk for developing OA. There's also some notion that physical activity or occupation play a role. That's kind of a contentious issue where there is evidence to suggest that people who have occupations who maybe are more physically active, bricklayers, carpenters, things like that, tend to be down on their knees or their hips a lot more often. Those people tend to have a higher rate of OA. But the overall cause of OA is not necessarily known. OA affects all of the joints of the body. It affects women more than men. So there's statistics out there that would suggest that about 18% of the overall adult population is affected by osteoarthritis. Women tend to be affected more, so it's up around 20% versus men, which is down around 16%. And as I mentioned earlier, these numbers tend to increase with age. So over 50% of women above the age of 60 have changes in their joint that are indicative of osteoarthritis. So yeah, all of the joints of the body are susceptible to osteoarthritis, that breakdown of that cartilage. The main ones that tend to be affected are your weight-bearing joints. So it goes back to that notion of overloading the joints. So we're looking at the hip, we're looking at the knee. The knee is the most commonly affected joint. The ankle and the toes are also commonly affected. There's also osteoarthritis of the fingers, and these tend to be people who use their hands a lot. So they'll overload their fingers, they'll overload their hands, and that breaks down that cartilage. Once you get up to the more severe osteoarthritic changes, more severe pain, more severe dysfunction, you're really limited in terms of your treatment options to joint replacement surgery. And joint replacement surgery is certainly a very successful treatment approach. It basically relines the joint with an artificial material, typically metal or plastic, and it takes away a lot of the pain and a lot of the dysfunction. But as I said, that's the treatment for joint replacement is really only for people who have more severe, very limited in terms of physical abilities. At the other end of the scale, the more mild, the early onset of symptoms, there's a number of options. A lot of people will take pain-relieving medications. That's a very common approach. It could be either your over-the-counter Advil, Tylenol, ibuprofen, things like that, or there's also some prescribed drugs that can be pain-relieving medications. There's a lot of physical activity modifications. So if it's something that is causing pain during a particular movement, or someone who has a job, you can change the way the person moves or the job requirements. But really the cornerstone for treatment of OA, pretty much from mild all the way through severe, is exercise and physical activity. Right, so exercise is really the best thing that you can do for OA. It does a number of things. It keeps you fit, keeps you active, keeps your muscles strong. There's two different types of exercise that you can do. One is more aerobic, so that is working your heart, working your overall body. Going for walks is really the best way, keeping your heart and your joints moving. The other one would be through muscle strengthening exercises, and those can be done either at a gym or they can be done at home using weights that you would purchase, or we can use other types of materials that would give you resistance and make you work a little bit harder. Now the good thing about the research is that there's been no differences shown between your aerobic exercises and your muscle strengthening exercises, so there's no one best way to do it. So what I would suggest is to do a bit of both, a bit of aerobic, go for walks, things like that, and do some muscle strengthening exercises as well. So what you want to do is to keep your muscle strong. What that does is it takes some of that weight off your joints. Every time you take a step or move around, there's forces and whatnot that go through your bodies. And if you can keep your muscles strong, they can kind of act as shock absorbers to offset some of those loads, so it doesn't go through your joints. For people who have arthritis, so say the hips or the knees, what we really want to work on is strengthening the muscles on the front of your legs, which are the quadriceps, the back of the legs, which are the hamstrings, and your hip muscles. So there's a couple of really good exercises we can do. And if you've got something like this, which is a cuff weight, you can purchase them easily at any sort of department store or anything like that. Or you can use simply a bag with cans of soup in it to provide a bit of resistance. First one that I like to do is working on the front of your thigh, which is your quadricep muscles. And really all you're doing is lifting your leg, kind of straightening it, holding it. You can feel it working through there and lowering it back down. You would do that 10 or 15 times, take a bit of a break, and you would do that 2 or 3 times repetitive. So you're looking at anywhere between 30 and 40 repetitions. The other ones you can do for working at the hip is simply holding it out to the side, holding it for 3 to 5 seconds, and coming back. So this one can either be done standing up or lying down on your side, and you should feel it kind of in the outside part of your hip. You might want to hold on to a chair or a wall or something, provide a bit of stability so you don't lose your balance. And you're just holding it out to the side, 3 to 5 seconds, and bringing it back down. Next one, working at the back of the thigh or the hamstring muscles. Again, you can hold onto a chair or whatever you want for the stability of balance. And you're just bending your leg, holding. You should really feel that in the back of your leg. Coming back down. And again, you're doing these 10 or 15 times, taking a break, and repeating that 2 to 3 times. Another good one that's actually working all of the muscles is the front of the thigh, the quads, the hamstrings, and the hip muscles. You would do this against a wall, and they're called mini squats. And basically what you do is you kind of go down, hold it for 3 to 5 seconds, and come back up. Go back down. Again, you should really feel that in the front of your legs, the back of your legs, and your hips. A couple things about how to do these exercises. Kind of let pain be your guide. So just going down to the point, if you feel pain there, maybe just come back a bit, and that's where you're going to hold it. So the goal here is to be as active as possible and to strengthen these muscles up as much as you can. So I hope you found that informative. I think the key point here is that osteoarthritis and other types of arthritis don't have to limit the things that you do. There's lots of different treatment options. Physical activity and exercise is really the main driving treatment for people with arthritis. You can do it, it's not a problem. It's not going to hurt your joints. If anything, it's going to make you better.